Welcome to our NPTE Question of the Day series presented by Typical PT. Today, we are going to be discussing a question from Typical PT's platform. Let's jump right in. The question is, a 78-year-old woman living with her daughter is visited at home by a physical therapist for management of chronic lower back pain. The patient is usually upbeat but appears withdrawn and hesitant during the session. The therapist notes multiple bruises of different stages on her arms and a recent burn mark on her hand, which the patient dismissively attributes to clumsiness. The therapist also observes that the patient flinches at sudden movements and seems fearful when her daughter speaks to her. The patient's blood pressure is higher than usual at 160/90 millimeters of mercury, and she appears malnourished. In this scenario, what is the most appropriate initial action for the physical therapist to take? A. Directly confront the daughter about the suspected abuse. B. Report the findings to a supervisor and discuss the need for a potential adult protective services referral. C. Advise the patient to avoid situations leading to injuries. D. Document the findings and continue monitoring in subsequent visits. Go ahead and pause the video right now, think through the logic, and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is choice B. Report the findings to a supervisor and discuss the need for a potential adult protective services referral. Answer choice B. Report the findings to a supervisor and discuss the need for a potential adult protective services referral is correct. The clinical presentation, including the signs of physical abuse, multiple bruises of different stages and a recent burn, behavioral changes, withdrawn behavior, flinching, and fear, the new onset of high blood pressure, 160/90 millimeters of mercury, potentially due to stress, and the appearance of malnourishment, strongly suggest suspected elder abuse. As a healthcare provider, the therapist has a responsibility to report suspected elder abuse. Discussing with a supervisor can provide guidance on the appropriate steps, including a possible referral to adult protective services. A PS. Now, let's look at why the other options are incorrect. Answer choice A is incorrect because confronting the daughter directly may escalate the situation and is not within the therapist's professional role. It could also put the patient at greater risk. Answer choice C is incorrect as it implies victim blaming and does not address the potential underlying issue of abuse. Answer choice D is incorrect because while documentation is important, it is not sufficient as the only response in a case where there is a strong suspicion of abuse. The immediate reporting obligation takes precedence. Now that you've gone through this case, take a moment to jot down all the key points in your typical PT digital notebook. Use it to organize your notes, highlight concepts you found confusing, or mark areas you want to review later. This feature isn't just for note-taking. It can serve as your personal reviewer, helping you track what you've mastered and identify topics you still need to strengthen, ultimately improving your retention and understanding. Thanks for watching today's Question of the Day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.